ba-boom, 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 ba-boom. You hear how that's regular? Like just like kind of like clockwork? That's a fabulous heart rhythm. Okay, so maybe maybe my improv is not the best, but a regular heart rhythm that we would expect is something that's regularly occurring. Ba-boom, ba-boom, ba-boom. Okay, now let's get to AFib. And by the way, I'll never forget when I was a medical student, first time I heard AFib on a patient I was evaluating in the ER when I was studying in New Jersey. And I remember I listened and I was like, ooh, because it sounds something like ba-boop, 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 ba-boop. It's all over the place. It's irregularly irregular, which means it's all over the place. You hear that difference? We are talking about atrial fibrillation, or AFib for short, guys. I'm Dr. Jen Caudle, practicing family physician. So glad you're with us. I'm going to tell you why it is so important if you have AFib to make sure that you are getting treated, what the biggest risk is that we worry about, but I'm also going to tell you who gets it and all that good stuff, okay? So that's a little sort of primer about atrial fibrillation. You could probably go on YouTube and hear some heart sounds of atrial fibrillation, but it is quite distinctive. And again, I will never forget the first time I heard this. So you say, what's the deal with AFib? It's an arrhythmia, which means it's an irregular beating of the heart. It's not regular like clockwork. It's irregular. It's erratic. It's one of the more common sort of heart conditions that we see. And the thing is, there's a problem with the electrical system of the heart. The electricity that travels to tell each sort of part of the heart to pump and do its job is not functioning the way it should. And so that electrical system has kind of gone haywire, and thus our heart is beating sort of erratically. Of course, there are other things that go into this. I'm just sort of boiling it down, distilling it down to sort of bite-sized pieces. The thing about it is a lot of people have atrial fibrillation. You might, by the way, let me know in the comments if this is something that you deal with or someone you know is dealing with this. We know that 2.7 million Americans have atrial fibrillation. It is something that literally I have patients every week that I see with atrial fibrillation. Not long ago, a couple of weeks ago, I diagnosed it in a patient who didn't realize that they had it. Now, symptoms. First of all, not everyone who has atrial fibrillation or AFib has symptoms, okay? You may not have any symptoms, but many people do. Some of the more common symptoms is people feel like, gosh, I just feel like I've got these palpitations, or my heart is beating fast, or you might feel that it's beating irregularly, or it just feels like it's beating out of your chest. Some people have palpitations, but other people just have shortness of breath. They get winded really quickly. They just feel out of breath, fatigued, like I don't have any energy. Because remember, your heart pumps blood, right? You need blood to have oxygen, to have energy, and all this kind of stuff. So if your heart is not pumping properly because it's doing boop, 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 you may feel tired, you may feel short of breath. Also, weakness. Sometimes people get chest pains, and many people actually I've seen get dizzy, okay? Because remember, we need oxygen via blood flow to our brain as well. But again, as I mentioned, not everybody has symptoms, which can make it sometimes a little difficult for us to find it in some people if they don't have symptoms. By the way, you can hear this on stethoscope when we're listening. Oh, we hear it very clearly. It's just sometimes people may not know that they need to come in for a problem if they don't have symptoms, okay? Now, this is the thing. Atrial fibrillation could be either short-lived, it can come for a small period of time, or it can be there lifelong. But one of the biggest risks of atrial fibrillation, meaning why is this so important? Why am I doing a video on this? Well, I'm doing a video because, by the way, one of you asked me to, and I thought it was an excellent topic idea. But the other thing is because your risk for stroke goes up with atrial fibrillation. Guys, the risk of stroke is one of the biggest things we worry about with AFib. You say, well, how does the risk for stroke go up? Well, the thing about it is when our heart's just kind of willy-nilly beating, contracting, just doing stuff on its own pace, sometimes that allows blood clots to form and then be pushed out in different places through our body, right? And strokes can occur because one type of stroke is a blood clot to the brain, all right? So we worry a lot about strokes. AFib does increase your risk for strokes. Also increases your risk for things like heart failure, other heart rhythm problems, chronic fatigue, etc. This is why we want to treat AFib amongst other reasons. Now you say, is it treatable? Well, the good thing is yeah, it is. We don't always need to get that rhythm back to boom, boom, boom. But we often need to get the rate or the speed back to normal. Sometimes we do need to get the rhythm back to its like clockwork form. And many people need blood thinners as well. That is to thin the blood to reduce the risk of stroke. Now, some people are going to need procedures or surgeries, but the idea is, yes, There are treatments, so don't you worry. I'm saying all this to say that whatever treatment your doctor gives you, this is really important to take. If you got questions about it, make sure you ask. But understand, it's super important. Do not blow off AFib. And you might say, well, who's at risk for getting this? I mean, how would I know if I'm at higher risk? Well, people who are at higher risk are people who are of older age. It's more common in people with an older age than younger age. People with high blood pressure, coronary artery disease, other conditions such as an overactive thyroid and other things can actually predispose you to things like AFib. People who drink alcohol, family history, sleep apnea, even athletes. So there's a number of people who may get this. The most important thing is just make sure you're seeing your doctor regularly for checkups. I always say that because, well, it's important. Guys, I want you to let me know, are you familiar with AFib? Do you know anybody with it? Have you ever had it? Do you have it? Are you on treatment for it? Write in the comments, because sometimes what you say helps other people. Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I hope this was helpful. Let me know. Please subscribe to my channel. Click the little bell for updates. Also, go to my website at drjencaudle.com for an exclusive offering of daily health tips directly to your inbox, your email, to help you live a healthier life. There's also a 7-day free trial included. Guys, I'm Dr. Jen. I'll see you soon.